Welcome guys, welcome to Medicine Culture, welcome to another interesting video which is atrioventricular block. So what is an AV block? AV block, it's an impaired conduction that is happening at AV bundle, which is also called as the bundle of His. So generally there is a conduction delay at bundle of His. So if you take the normal conduction system pathway, you see that the impulse, the way of depolarization starts from the SA node, then it travels to the AV node, then to the bundle of his, that is AV bundle, which is left and right, and the Purkinje fibers. Yes, so this is the normal conduction system of our heart. So in an ECG of atrioventricular block, tell me which particular interval or segment denotes the passage of current across the AV bundles. Which one? Yes, it is the PR interval which denotes the passage of current across the AV bundles. So the normal value of PR interval, which is roughly around 120 millisecond to 200 millisecond. So this is the normal value of the PR interval, roughly around 4 to 5 small squares. You can take it like that. So in an AV block, what happens to this PR interval? Yes, this PR interval is prolonged, and which means that it is more than 200 millisecond. So the PR interval, which is more than 200 millisecond, so this is an indicator that um, there is a conduction delay in the AV bundle. So PR interval is a definite indicator. PR interval which is prolonged is a definite indicator that there is a conduction delay across the AV bundles or the bundle of His. So moving on to first degree heart block. First of all, the stuff that we need to know regarding the first degree heart block is that firstly, there is a PR interval prolongation. As usual, there is a conduction delay in a first degree heart block. And secondly, the first degree heart block is always a sign of coronary artery disease. And secondly, it will be, yes, acute rheumatic carditis, which is very, very important. And thirdly, it is digoxin toxicity. Okay, digoxin, it's a cardioglycoside. And fourthly, it is electrolyte imbalances. So electrolyte imbalances is such as potassium, sodium, and bicarbonates. So basically, first degree heart block, it's an indicator for any heart disease. Whenever you see a first degree heart block, it's an indicator for any heart disease. Just remember that. So moving on to ECG or first degree heart block. So whatever we studied, we are going to implement here. The PR interval, you see 1, 2, 3, 4, 5, 6, 7. So it's roughly more than 200 millisecond. The PR interval is more than 200 millisecond. Okay, then we can see another different pattern of P wave. You see a distorted T wave. Actually, it's not a distorted T wave, but a P wave in a T wave. You can find it here. You can look all over the leads, and basically the thing that you're seeing is not a T wave, but it is a P wave in a T wave. Yes, it's a P wave in a T wave. So you can see that each P wave is followed by a QRS. So there is no missed conduction. It's just only a PR interval is more than 200 millisecond, and there is no missed conduction. So this is the first degree heart block. So moving on to second degree heart block, there are two types. So first type, which is Mobitz 1, or otherwise called as a Wenckebach pattern. So what is a Wenckebach pattern? We know three bundles, right? In our ECG basics we studied Bachmann, Thorels, and Wenckebach. So Wenckebach is from SA node to AV node, one of the bundles. So in a second degree heart block, which generally means that excitation was failed to pass through the ventricles. So excitation fails to pass through the ventricles. So there are many changes in ECG that we can denote. So there will be a missed conduction also in this particular type of ECG. So first of all, PR interval will be higher, will be more than 200 millisecond, which is associated with prolonged lengthening of the PR interval. So which means that PR interval is rising for each cardiac cycle, and we'll be seeing that in an ECG also. And thirdly, yes, it's a missed conduction, as I said before, which means that there is an absence of QRS complex in an ECG in across the leads. So these three things will confirm the diagnosis of the second degree heart block. which is that PR interval is more than 200 millisecond, along with prolongation, lengthening of the PR interval, and missed conduction. So these three will give you the diagnosis of the second degree heart block. As soon as you see these three stuffs, you should be sure that you are in Mobitz type 1 second degree heart block. So let's look at an ECG right now. So let's figure it out. Let's find out together what type of heart block we're dealing with. Okay, one by one, let's go. So we can see clearly that um, a missed QRS complex in this leads. Yes, we see here that there is a missed QRS complex. And what we can see here is that we see prolonged lengthening of PR interval. You see 260 millisecond, then 280 millisecond, then 320 millisecond. It's just for each cardiac cycle, the PR interval is increased. Yes. So the prolonged lengthening of PR interval and a missed conduction is Mobitz type 1. You see this pattern is repeated again after the missed conduction. After the missed conduction, you see the same pattern again 260, again 280, again 320 is just repeated. So this repetitive fashion, that is 260 millisecond, which is more than 200 millisecond, and 280 and 320 millisecond, you see the same type of fashion that is repeated again after the missed conduction. You must notice this. If you see a missed conduction and again the same pattern of PR interval that is repeated, whatever the interval may be, it can be 250 or whatever the interval that you get. If the same interval repeats after the missed conduction, it is a typical Mobitz 1 second degree heart block. You see here 260, 280, and 320. Same fashion, and you'll be seeing a missed conduction after that also. So this manner of repetitive um, missed conduction and prolonged lengthening of PR interval is a typical diagnosis of Mobitz type 1 second degree heart block in an ECG. So moving on to the next tab, which is Mobitz type 2 second degree heart block. So here's where you get a major difference between type 1 and type 2. So first of all, PR interval remains constant even though PR interval is higher than 200 millisecond, but the PR interval remains constant across the leads. Whereas in Mobitz type 1, you see that there is a prolonged lengthening of PR interval, but in type 2, you see that the PR interval remains constant. And secondly, we see that atrial depolarization without ventricular depolarization. That means that P wave is not followed by a QRS. So there is a missed conduction here also in Mobitz type 2. There are three different types of Mobitz type 2. One is 2 is to 1, and the other is 3 is to 1, and 4 is to 1. So what is meant by 2 is to 1, 3 is to 1, and 4 is to 1 is that the number 2 denotes the number of P waves, and number 1 denotes the QRS complex basically. So for example, 2 is to 1 means there will be 2 P waves for 1 QRS complex. So back to Mobitz type 1, you see that PR interval is greater, and there is a prolonged lengthening of PR interval, which is different from Mobitz type 2, which means that PR interval remains constant across the leads. Let's look at this ECG. So we are going to find out which type it is right now. So we'll be noticing that there are two P waves for one QRS complex across the leads, entire leads, two P waves for one QRS complex. Yes. So, and you'll be noticing that the PR interval also remains constant. You see, PR interval remains constant across the leads, entire leads. For each cardiac cycle, PR interval remains constant. So which means that this ECG is Mobitz type 2 of 2 is to 1 degree. And the last one, which is third degree heart block, which is also called as a complete heart block, where you'll be finding the atrial contraction remains normal here. Atrial pacemaker here remains normal. Yes, but the problem is that no impulses are conducted to the ventricles because of fibrosis of or complete block in the His bundle fibers. No impulses are conducted to the ventricles. That's why we get a complete heart block of the third degree. And not only these two, the patient will be having severe bradycardia. The length of the RR interval you'll be finding in a complete heart block, the length of RR interval is very, very large, which means that the heart rate of the patient will be very low, less than 50, most probably. It's why because the ventricles aren't in pace with the atrium, um, but ventricles contract in a special type of mechanism which is called as the silent escape mechanism. The ventricles contract by a mechanism which is called as silent escape mechanism. Let's see this last ECG. Okay, we find here is that P wave, presence of P wave, which is called as sinus. Okay, the ECG is sinus, but you see more number of P waves here in the second lead and also in the first lead also, which means that there is P wave, but the P wave is not conducted. If usually a P wave is present, means there should be a QRS which should be followed, but here P wave is not conducted, sinus but not conducted. Well, so what's next? Yes, we see here the length of RR interval. You see the number of large squares, 1, 2, 3, 4, 5, 6. Okay, it's like 300 divided by 6. It's roughly around 45 beats per minute. It's roughly around 45 to 50 beats per minute. So it means that this patient has severe bradycardia. And then what we find is that we find a wide QRS complex in this patient. This patient has a wide QRS. Um, Normally QRS complex should be between 80 to 100 millisecond, which means that 2 to 3 small boxes, right? So this patient, I think so he has roughly around 4 to 5 small boxes, which means that 160 millisecond. Yes. So another important thing for you guys, a small tip: if you find if you get a complete heart block ECG, if you find a complete heart block, you must also try to find the signs of bundle branch block. Yes, in a complete heart block ECG there will be a sign of bundle branch block. It might be either right bundle branch block or left bundle branch block. Yes, here in this patient, in this ECG, we can find right bundle branch block. Okay, let's figure it out. Okay, let's take the first lead. You find RS pattern, a typical RS pattern in lead 1, and you find an RS pattern same in AVL, and also you find a QR pattern in lead 3, and you find same pattern QR pattern in AVF. So for a right bundle branch block, there is an RS pattern in lead 1 and AVL and a QR pattern in lead 3 and AVF. You'll be finding lead 2 also. So okay, let's go for the check for the precordial leads, which is a chest leads, where you can find the deep deep S wave in V5 and V6. You see a deep S wave in V5 and V6, and a kind of splitted RSR pattern, in V1. It's like an M pattern, right? So we have found RS pattern in lead 1 AVL and QR pattern lead 3 AVF, and deep S wave in V5, V6 lateral leads, and kind of M pattern, RSR pattern in chest leads V1. So this will say you about a right bundle branch block with a complete heart block. Actually, complete heart block with a right bundle branch block signs. So whenever you get an ECG of a complete heart block, do refer to the heart bundle branch block signs. There will be bundle branch block signs. Yes. And do not forget these three important points. Atrium is normal, no impulses connected to ventricles, and severe bradycardia, which is very, very important. Okay, let's take a recap of complete AV block, whatever I taught you. Yes, AV block, which is an impaired conduction at AV bundle. The main focus here is PR interval, which is more than normal, so there is a conduction delay. In first degree heart block, there are PR interval is prolonged and it's an indicator of heart disease. And in second degree heart block, Mobitz type 1, we see PR interval lengthening, prolonged lengthening of PR interval and a missed conduction. And in Mobitz type 2, we see PR interval remains constant here and P wave is not followed by QRS. And there are three types: 2 is to 1, 3 is to 1, and 4 is to 1. Do not forget, in Mobitz type 1 it's prolonged lengthening, and in Mobitz type 2 its PR interval remains constant here. And at last we come to third degree heart block. Yes, atrial remains constant here. There is severe bradycardia and ventricles conduct by mechanism called as silent escape mechanism. And the last one, whenever you get a third degree heart block ECG, do find for signs of bundle branch block. Yes, that's so important. And okay, guys, that's all about AV block and its types. I made it very simple for you guys. Do refer more books, do study about this very more to gain knowledge, more knowledge, better understanding about AV block and its ECG. Practice more ECGs so that you'll be able to crack out any type of ECGs, any type of blocks. So that's all about AV block. So thanks for watching.